Hello, everyone. Welcome to the Dental Digest with the Study Boards. Now, in today's episode, we will cover viral infections that have been tested in the exams. It's an important topic for oral pathology, and we will be talking about Varicella Zoster Virus. Now, step one is that we will cover the diseases it causes, complications, the symptoms, mode of transmission, methods of prevention, diagnosis, and the treatment. So, let's get started. Now, VZV is a type of herpes virus and it's a part of a same family as the herpes simplex virus. What makes it unique is its ability to remain dormant in a nervous system even after the initial infection, and then it can reactivate later in life. Now, VZV, it can cause two main diseases, chickenpox, which mainly affects children, and shingles, which is more common in older adults, or you can say in immunocompromised individuals. And like other herpes viruses, once VZV affects you, it stays with you for life, sometimes reactivating under certain conditions. Now, chickenpox is usually mild in children, but can sometimes lead to very serious complications like you can have pneumonia or bacterial infections of skin. And on the other hand, shingles occurs when VZV reactivates later in life, causing very painful rashes. And this condition can lead to postherpetic neuralgia, which is a type of a nerve pain that can persist long after even the rash heals. So basically, both these diseases are significant concern for public. Now, next we have to talk about the complications. Now, Ramsay-Hunt syndrome, it's a rare but serious complication of varicella zoster virus reactivation, where this virus affects the facial nerve near the ear. Now, this condition usually occurs in people who have had chickenpox in the past, and then when the virus reactivates, it leads to a very painful rash in the ear canal or mostly around the ear, along with facial paralysis. And the syndrome can also cause hearing loss, vertigo, and tinnitus. Now, what makes Ramsay-Hunt syndrome particularly concerning is its impact on the facial nerve, which leads to weakness or even you can say complete paralysis on one side of the face. And that is why early diagnosis and treatment are critical for reducing the severity and the long-term complications that can arise. Now, the symptoms of Ramsay-Hunt syndrome are more severe than those of shingles alone. They include a painful rash in or even around the ear, facial muscle weakness or paralysis on the affected side, hearing loss or ringing in the ear, dizziness or vertigo. And our patients may also experience difficulty closing one eye, making facial expressions, and even the issues with the taste on the affected side of the tongue. Now, the treatment for Ramsay-Hunt syndrome focuses mostly on the antiviral medications like acyclovir, valcyclovir, alongside corticosteroids, which are given to reduce inflammation. And the pain management, obviously, it's crucial because the pain can be severe and persistent. So, early treatment is critical as it can help you improve the chances of full recovery, especially if it is started within 72 hours of the symptom onset. Now, however, even with the treatment, some patients may have lasting facial weaknesses or hearing problems. Now let's talk about the symptoms of VZV infections. And typically chickenpox, which starts with fever and malaise and followed by a itchy rash that begins on the torso and then it spreads outwards. And the rash progresses from red spots to fluid-filled blisters which eventually get covered by crust. And now shingles, on the other hand, is characterized by severe pain followed by a localized rash that only affects one area of the body, and often a band-like pattern is seen along the nerve path called as dermatome. And the pain can sometimes be very severe and long-lasting even after the rash disappears. Now, VZV is very contagious. Chickenpox can spread through respiratory droplets, meaning it can be easily spreading through infected person's cough or sneezes because the virus is technically traveling through the air. And it can also spread through direct contact with the fluid from chickenpox or shingles blisters. Interestingly, a person with shingles can give someone chickenpox, but not the other way around. So, very important point. And the virus is most contagious 1 to 2 days before the rash appears. This is an exam question, which is why it spreads so easily. Now, the good news is that vaccines are highly effective at preventing both chickenpox and shingles. The varicella vaccine is given to children to prevent chickenpox, and it has really significantly reduced the number of cases and the complications. For adults, particularly those who are over the age of 50, the zoster vaccine, like Shingrix, is recommended to prevent shingles. Along with vaccination, basic hygiene practices like avoiding contact with infected individuals, isolating those with active infections are also crucial in controlling the spread. Now, the diagnosis of VZV infection is usually based on clinical symptoms, particularly the appearance and location of the rash. For chickenpox, the widespread vesicular rash is a key sign. And for shingles, localized rash and severe pain is going to help us distinguish it. And if needed, even the lab tests like PCR could be used to detect the virus DNA in the samples from blisters or the blood. And in cases where there are complications such as pneumonia or encephalitis, imaging tests like X-rays or MRIs can also be used to evaluate the extent of the infection. Now, the treatment for chickenpox is usually supportive, meaning we just focus on easing the symptoms out. And this includes keeping the patient hydrated, using any fever reduction medications like acetaminophen, or applying anti-itch lotions to make the patient more comfortable. And for those who are at high risk of severe diseases like newborns or immunocompromised individuals, antiviral medications like acyclovir may even be prescribed. Now, for shingles, antiviral treatment is essential to shorten the duration of infection and reduce the severity of symptoms. Acyclovir or valcyclovir are often used, and pain management is key to reducing discomfort. Now, in some cases, corticosteroids and anti-neuralgic medications are used to prevent long-term pain after the infection clears. So what are the key points now? So the key points on chickenpox and shingles, first of all, causative virus, that is Varicella Zoster virus, which causes both chickenpox, varicella, and shingles, that is herpes zoster. Second thing is that VZV is a part of herpes virus family, similar to the herpes simplex virus, that is HSV, and it can establish latent infections in neurons which are leading to reactivation later on in life. Then we have to remember regarding the transmission. And when exactly is it highly contagious? That is, it can spread 1 to 2 days before the rash appears until the blisters form scabs. Then we have to remember regarding primary infection, that is chickenpox, which is classically seen in childhood. We have itchy blisters, right? So then we have to talk about how VZV lies dormant in the nerve cells. We have to remember about the reactivation, that is shingles. That is, shingles occurs when VZV is reactivated, happening typically in older adults. Then we have to understand the comparison to that of HSV and the similarities to that. So that is also important. Then we have to remember that VZV is primarily spreading through respiratory route because it has a smaller genome. Then we also understand it has smaller replication and it infects fewer cell types as compared to that of HSV. Then we have to remember the treatment part as well as the prevention, where we have to remember the vaccinations, especially what vaccinations are important for your chickenpox and what are important for shingles. So that is all that you need to remember for VZV, Varicella Zoster Virus. In the next episode, we will talk about another viral infection that you have to remember from your exam perspective. Until then, take care, keep working hard, and rock it.